Rhea Flores, as coronavirus cases start to spike once again, many of you have a lot of questions about the virus, and that's why every week we talk to CBS 4 Medical Editor Dr. Dave Hnida. And Dr. Dave joins us now to get those questions answered. Dr. Dave, last week, Governor Jared Polis made masks mandatory in Colorado. Do you think having a mask mandate is really going to make a difference?
I do. I think, first off, you have to take a look at what's going on in the state right now. We're seeing increased case counts. We're seeing more and more hospitalizations. We're seeing more positive percentage of tests come back. And I think everybody's getting nervous because this is a pretty rapidly spiraling situation. And I think that everyone in the healthcare community is very nervous about what's going to happen in the times ahead, particularly by the time we hit September, because that's a time when there really may be the potential for a crisis when it comes to hospital beds. So you say, well, why did this all happen? How did we go from good to we got a problem now? Well, I think it really is a matter of people have not been socially distancing. People have not been wearing masks. They've been gathering in larger groups. We've got tourists coming into our state. So there has been some personal responsibility that has played a role here. And so what happens is the governor takes a look at what's going on inside of our state and sees that even within our state, areas of the state that have high mask usage, they have fewer cases than other parts of the state that does not have a little stricter mask usage. And so you say, well, the mask would be effective if we made it more of a statewide mandate. And I think when you look at the situation nationally, you'll see a very similar picture. So I think it is a wise move on the part of the governor. And, frankly, when you look at it from the standpoint of you see someone wearing a mask, you know that they are thinking about not just their own health, but the health of their loved ones. They're thinking about kids going back to school, their kids going back to school, teachers and support staff. They're also thinking about jobs, employment. They're thinking about keeping the economy going and people getting a paycheck. So, yeah, it is a good move.
And last week, the CDC director said if we all wear masks for 4 to 8 weeks, we could get coronavirus under control. What's your reaction to that statement?
Well, I like the statement. I think that it's good having a positive message come from the CDC on this. I think it's a little bit optimistic. I think it would take a little bit longer to see an effect. But the other issue is the fact that what really are you aiming for when it comes to the number of people wearing masks? I don't think we're ever going to get to 100%, but we do think that if you get to about 80%, 4 out of 5 people using a mask within the country, it will be as effective as a stay-at-home order throughout the country and a shutdown in terms of lowering case counts and getting us into a better place. Right now, incidentally, the current mask usage is estimated to be just about 59%. So it's not as high as we really need it to be. I think the other thing is that a lot of people say, well, you're telling me something one time, then you change your mind and you're saying something else. We get a lot of different advice, the science we can't believe. I think the big thing to remember is that, science and medicine in particular is not something that is, a situation where your feet are encased in concrete and you never move. This is a fluid situation. We're learning as we go. You have to remember that we really didn't know very much, if anything, about COVID-19 in the beginning of the year. And so it is a matter of changing and adjusting to current conditions and trying to make the appropriate right decisions.
And travel is starting to pick up again, with DIA reporting an increase of traffic. If you've traveled and you're worried about being exposed to coronavirus, when exactly should you get tested?
Well, it's funny. You look at it 3 ways. First off, are you sick? upon your return or sometime after you've returned. And I think if you have any signs or symptom of illness, and not just simply the classic, fever and cough and so forth, you got to remember there are about 18 to 20 symptoms that are associated with COVID-19. So anyone who is sick needs to self-isolate and be tested. Let's say, though, you did come in contact, whether it be travel or you were exposed to someone in a workplace or someone in your household. In that particular situation, you may be feeling well, but you are going to need to consider self-quarantining, monitoring, seeing what's going on with the state of your health, and also consider testing. And then you have folks who have no symptoms whatsoever. They feel fine, haven't really done very much. And it's like, well, am I asymptomatic? Am I ill, but just don't know it? In that particular situation, being tested is certainly not out of the question. I think the important thing to remember is that the average time for people to become ill after being exposed with COVID-19 is just about 5 to 7 days. But actually, when you look at the range, it is more 3 days from exposure to 14 days from exposure. So it's a pretty widespread. I think this is a situation where you have a question about whether or not you should be tested. This is one time call to your healthcare provider is definitely a good idea.
Dr. Dave, thank you as always for joining us. We'll see you back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just head to cbsdenver.com. We'll be right